This is Heart Rhythm TV. I'm Deepthy Varghese. I'm joined by Dr. Sofian Johar from Brunei. Welcome.
Hi, Deepthy. Thank you so much for asking me to speak. I come from a country called Brunei, which is a small country in Southeast Asia with only around 450,000 people. And it's great to be here to talk to you.
Thank you. Dr. Johar, can you share how social determinants of healthcare, including income, education, and access to care, impact the management of heart rhythm disorders, specifically in the Asia-Pacific region?
As you can imagine, Deepthy, the Asia-Pacific region is a very big region. It covers a very wide geography, temperate climates to tropical climates, as well as at very different incomes in terms of the median income of the population, and as well as the funding model as well. Some are totally reimbursed, some are reinsurance, and some are totally out-of-pocket expenses for the patients. So this has a big impact on arrhythmia care in general, especially here at this meeting, because we've been focusing a lot on very high technology innovations, and some people barely have access to ECGs.
What strategies do you believe are essential for healthcare providers to address these critical issues?
I think there are a couple of things. One thing is is improving access to care. So one of the features that we've been hearing about is that there's a lack of trained individuals capable of providing arrhythmia care. So a lot of the meeting has been focused on education of physicians to deliver basic arrhythmia care. The other aspect would be funding. For example, data that we get from these meetings can be used to have discussions with healthcare providers and governments in order to impress upon them the burden of arrhythmia care and how this impacts on health. One example might be atrial fibrillation and stroke. There's been an initiative here led by Sanders actually for this meeting, where they invited people from the Asia-Pacific region to collect data on incidents of atrial fibrillation. And actually, we found that over 80 million people in this region are affected by AF, which is perhaps a bit higher than what other people have shown in the past. And, this is high air burden in places like China, Mongolia. These are very big countries, disparate populations with limited access to healthcare, and this will be a big problem.
Well, thank you so much for highlighting a very important point, specifically for this region, but for heart rhythm societies globally.
Thank you.
Thank you.